GP.
Healthy living.
Dermatologists.
Dentists.
Gum clinics.
The hospital.
Stopping smoking.
And there's sexual health clinics. Drugs clinics.
Accident emergency.
People with alcohol abuse, there's places for that.
These are just some of the health services that we use each day in Fife. They are managed and provided by the Board of NHS Fife.
For the first time this May, young people aged 16 and over are getting to vote in these elections for members of the NHS Fife Board. These members make the decisions in the way these services are delivered.
Professor Jim McGoldrick will tell us more.
NHS Fife Board is responsible for improving the health and well-being of the people of Fife, but we're also responsible for a pretty significant part of the public purse in providing health services for the citizens of Fife. Now, most people, when they think of the NHS, think of hospitals like the Victoria Hospital in Kirkcaldy, the Queen Margaret Hospital in Dunfermline, but actually most of us make most use of the NHS in a community setting, in our families, in our local GP practice. Direct elections to health boards gives us a great opportunity to open up for the first time in Scotland the chance for a whole range of people to have a say in the decisions that affect the organisation and running of their health services. So there's a great opportunity, particularly here for young people, with the extension of the franchise to 16 and 17-year-olds, to give some thought to the kind of health service that they want and to have a voice in the shape of that service.
But why should we be bothered about these elections to the NHS Fife Health Board? Well, because all of us and our friends and families use the different services that NHS Fife manage. Some of us use them when it's an emergency, whilst others use them every single day.
But we all have opinions about how these services could be improved.
This May, young people aged 16 and over can elect the people that will be making strategic decisions about how healthcare services are delivered in Fife for the next 4 years.
This is your chance to elect the individuals that you think will listen to the voices of young people and that will work with them to improve the health services that are delivered for young people in Fife in the future. So how are these elections going to work? Councillor Tim Brett, who represents Fife Council on the board of NHS Fife, tells us more.
Anyone who's on the electoral register and is over the age of 16 will be entitled to vote, and ballot papers will be coming out in early May, and we are inviting people to rank the people on the ballot paper and get their ballots back by the 10th of June.
This is the first time in Scotland that young people aged 16 and over have been given the chance to vote in elections for public office. It is up to all of us to make sure that we take the opportunity to elect members of the board who will listen to our views and who will work with us to improve health services that we and our family use every day.
And it is also really important to demonstrate that young people aged 16 and 17 will take part in elections and hopefully persuade the government to allow us to vote in all future elections. This is your chance to have your say, so are you going to vote?
Yes.
Of course we are, definitely, yeah. Yes, I'll definitely be voting in the elections.
Yes, we are.
I'm definitely going to vote. I don't know who for yet, but I'm definitely going to vote anyway.